Welcome everyone. This is part 2 from the practitioner's viewpoint, and we have physiotherapist Liis Kukkonen here, and we will be discussing how physiotherapists could use physical activity and sedentary behavior tracking in their professional work. So Liis, you are practicing physiotherapist. What is, from your viewpoint, the current status of using activity tracking technology in physiotherapy and rehabilitation?
I think it's an underused method, tracking activity. We do ask people about their physical activity, but it's very subjective. And we might have questionnaires, which is also subjective. So people usually tend to report more physical activity than what they actually really do. And some clients, of course, have watches to track their physical activity and exercises. Some people probably use their phone apps. But as professionals, I think at least here in Finland, we don't really track people's physical activity. So I see a huge potential really in doing that in a more professional and evidence-based way. So yeah, I don't know about really other parts of the world, but I haven't really heard that many physical therapists would do that. Tracking of physical activity of the clients.
Yeah, I haven't heard either. And in part 1, we discussed about how physiotherapy is actually behavior change. And if we look at behavior change theories, one important part is that you know where you are in relation what is your, for example, physical activity level, and you know that what kind of changes you need to do, and maybe that you are measuring that you can actually see the progress. So I think there definitely is potential in the tracking. But you said that you are asking from the patients, but it's not maybe reliable. How should the technology be that you as a professional could use some technology that it would really support your work and help in the behavior change?
Well, first, to come back to the previous question, it's about behavioral change, but it's also about changes in your, for example, your pain sensations during the physiotherapy period. So we can also have outcome measurement with activity tracking, because if, for example, when you have a chronic problem, then usually when you have pain, you will decrease your physical activity because you have pain. So it can be uncomfortable for you. So we could actually track physical activity to see if the pain has gotten better. So this is another way to kind of use trackers. But your other question was that what would be important for me as a professional. So I think that the most important thing is that it should be easy to use. Of course, reliable and evidence-based. That's, I guess, is the baseline. But it should be extremely easy to use, so that that basically I would like to see what is the person doing in their everyday life, or like how much are they exercising, or how much daily physical activity, non-exercise physical activity they would have. So to do that in an easy way. And I guess it's very important also that the device I'm using would distinguish between different actions that the person is doing, because then it's more individual, and giving feedback to this person would mean more to them. But for example, if you have let's say that somebody is doing swimming, they go swimming every day for an hour. And then if you have a tracker that can't track that, then it's not meaningful for that person. So it should be quite diverse and then easy to use. I guess these are the two most important factors I would think of quickly. Yeah.
And you said that we could use it as a tool to see that if the pain has gone away, and I think the same could be after a surgery. That, for example, if you have a knee surgery, basically your activity levels go to 0 for a few days, and then they should start to increase to before the surgery levels. So we could kind of use it as a secondary measure of how well the function is recovering and how well the pain is going away. And if we don't see the normal progress, it indicates that there's probably some problem, and we could start to look for that problem. How do you see this?
Definitely, there's a lot of groups of clients or patients we could use activity tracking for, and like you said, a surgery, because sometimes it happens. It shouldn't happen, but it still happens that somebody who's been active, then they have an injury. They get pain, so you get used to the pain and also the decreased physical activity. Then you have maybe, for example, you have surgery, and then after that, you should go back to the physical activity level that you had. But quite often, people are quite alone in that phase, at least here in Finland. So it would be really good if we could show them where they are. Maybe even if we don't have the baseline measurement from them, but then we could show them that do they meet the the recommendations about the daily physical activity. So that would also be good, because in the practical real world, having this, that's when I think it's, we see the difference of science and the real practitioner's view. Is in science you would have a baseline measurement, and then you would do an intervention, and then you would have the kind of the outcome measure, the follow-up. But in a clinic, when somebody comes with pain, then we can have a measurement from this painful period, but we can't go back in time and get their real baseline. But if we do, let's say we have a physiotherapy intervention, and then we can have a measurement. We can see if that person meets physical activity recommendations, for example. So this is one way we could use the activity trackers.
And we don't usually have a baseline, but if a person, for example, have a broken ACL, but it's still functioning, we could do the measurement before the surgery, and we would have some kind of baseline, even though it's real, but at least something that we could compare against. Or we could have a big reference database which would compare the same persons. But I think the physical activity recommendations provide a good reference in that sense.
Of course, for some people, not to everybody, because there's a lot of people who are much more active than the recommendations. But then there is also, you probably know that better than me, that there's a lot of people who don't meet the recommendations. So for them, that might be, or that could be a very good goal, at least in the beginning. I think.
And how do you see what would be the best measures? Like, we can measure sedentary behavior, we can measure different intensity of activities. What do you think, you can give some example cases, what would be the best indicators that, for example, the rehabilitation is going well and maybe the pain is going away?
I think if we could, maybe at some point, if we could see, let's say that there is this knee surgery that we were already talking about, and if we could really see that this person is activating in their daily life the thigh muscles well enough, I think that would be a really good indication if we could see that during this process of rehabilitation, that we could see how certain muscles and the activation of these muscles is developing, that would be very beneficial. And it would be really beneficial also because it's motivating for that person. The same maybe with some of the core muscle activation. If we could see for the low back pain patient, we would see how this develops, would be interesting. So these, I think that these would be a good additional things we should measure, or I hope this will be possible in the near future.
Yeah, so you would like to actually see the real muscle activity, like from the EMG, that how is the activity. And yeah, I've done my PhD with the EMG Sword, company from Finland called Myontech has EMG Swords, which can measure like daily muscle activity pretty easily. The electrodes are integrated, the wires are integrated to swords, and there's a module where the data is recorded. I'm not sure if this is, like you said, that it needs to be really easy to use from the practitioner's viewpoint. I think it's really easy to use as it's EMG, but I don't know how many kind of extra minutes you have in your reception, that like you need to do the paperwork for the patient, you need to do different kind of things, maybe have a short rest between patients. How many minutes you think you can have for something like extra things in your reception?
Uh, well, in the private practice where I work, I kind of can decide this by myself, and so we could have some extra minutes for that, and I think it would be beneficial for the patient. But of course, it's not like, for example, tracking muscle activity would not benefit everybody. So I think we should really find out who are the patients that this is beneficial for. So yeah, but for those, for example, I could see athletes, then rehab from surgery, where this could be important, but not for everybody, definitely. Yeah,
Yeah,
and it
yeah.
would be too time consuming doing this for every client, and it wouldn't give the benefit
Yeah,
for everybody. Yeah.
actually some 8-10 years ago we were looking with my colleague quite closely the EMG technology, as we had the business idea that we would actually make this kind of product that you can measure really easily EMG in daily life or in clinical practice. And there was many companies at that time who were developing this technology. Either it was a small module that you attach on the skin, or it would be integrated to clothes, but it looked really promising. But actually many of those companies, I think they are bankrupt, or they are not at least flying to it's not going too well. So I think there was problems that how to really make it practical. EMG is sensitive to movement artifacts. There needs to be electrode paste, or the connection is not very good and the data is not maybe reliable. There's always the normalization to maximum. It might be difficult at home to do, for example, maximum quadriceps activation. So I think it was a promising technology, and I think it can be in the future, but it's a little bit challenging.
Yeah, I think at the moment we can really focus on measuring physical activity and the performance and the daily activity, people getting back to what they used to do or raising their levels of physical activity. And maybe we have been forgetting, but for some people it might be also that there's too much physical activity. So you can track that also, and also this is important.
Yeah,
Yeah.
that's a good point. And so from physiotherapist point, actually seeing the muscle activity would be ideal, but it's maybe not easy enough. So I think we need to consider what could be the kind of the secondary measures. So you, for example, said that is the person activating quadriceps enough? So I could think that, for example, sit to stand transitions could be a good measure, because when you're sitting, you need to lift your body. Of course, you can use the armrests to help, which is challenging to measure. But I think if you have, for example, 65 sit to stand transitions and it's increasing, I think we can think that, all right, the person is really activating their quadriceps. This is probably good loading for the quadriceps in addition to the rehabilitation exercises. So I think this kind of things we could measure, or fast walking or something. It's not really quadriceps activation, it's more about hamstrings, but I think these could work. What do you think?
Well, and we do that already. There's lots of tests, as you mentioned, and there's also, we have the manual devices to, um, to measure muscle activity. Of course, we can just like move a certain joint, and then we have a manual measuring tool that we can use to get the power that muscle is creating. So yeah, we do that. So it's not like. I think that this combined to what the person is doing in their daily life, how much they're then using and moving, exercising, doing physical activity. So we get a quite good combination of that already. So different functional tests are basically our most used tools for the outcome measure, and also in the beginning to see what's the baseline.
Yeah. And I think if we would start actually collecting data from patients, and I think we would really learn that what are the best variables. I remember reading a couple of studies which had like knee osteoarthritis patients, and when they compared the ones that their pain was all right and the ones which had problems, was that there was no difference, for example, in the amount of steps. But when they divided that, they took like really short bouts of walking, like less than a minute, and then like over 20 minutes, then there was difference. So the ones who had pain and it was bothering them, they avoided taking like short walks, because I think starting moving was painful. And then also if it was longer, it started to get painful. So they had those. So it was really interesting that if you look the data, just an average of steps, for example, no difference. But when you started to look it more closely, you could actually divide people into groups, which would probably be clinically significant and could help in the practice.
Yes, I'm sure that's how it goes. Yeah, pain is changing the way we are moving in the long run.
Yeah. And how do you see, what kind of customers, what kind of patients group would benefit most from the activity tracking? What do you see? You probably meet quite many people with quite many musculoskeletal problems. So what do you see as the most potential?
So where do you start from? There's many. so we'll see. I would just name a few groups. I
Yeah.
think first is arthrosis, which is it's a non-inflammatory degenerative condition. People probably know it as a worn out or stiff knee or joint.
Yeah.
So this is a good condition, which usually you start getting pain. And, as you start getting pain, then you kind of reduce your physical activity. But in clinical practice, what we see, then you reduce your physical activity. And as a consequence of that, the muscle, you don't have so much power in your muscles or strength. Your strength decreases, and after that you get more pain, for example in your knee. So this is usually the point when people come to physical therapy. So this is where it's very it's very important that we give out correct information. So, for example, doing some biking in the gym gives very good results. So we start because then you need to have this knee needs to get some movement so that the pain would decrease. And after that, we can do some strength work for the thigh muscles, and then I have many cases where people they maybe can walk only a kilometer per day because of pain. They might have only 40 years of age. Quite often there's some overweight also, not always, but often. And then after working out for 3 or 4 weeks, these people are quite pain-free. So, for example, that would be a good group of patients that we could actually track their activity levels and see how it changes through the process. So another one, we already talked about the surgeries, rehab of surgeries. I also think that if we go out of the physiotherapy field, then, for example, Alzheimer's disease. Alzheimer's causes dementia and problems with recent memory. So there's some research suggesting that having Alzheimer's patients increasing their daily physical activity actually it will make their life better. And I'm not sure if the memory really gets better, but at least their performance of daily activities gets better. Low back pain, also chronic pain patients, many groups of patients who would benefit from activity tracking.
So if we consider, for example, low back pain, it's probably the most common problem. So you get them a lot. How do you see the importance of physical activity for them? Maybe avoiding sedentary behavior, maybe long sedentary behavior bouts. How do you see the importance of this in the getting rid of low back pain?
Low back pain, there's different reasons for low back pain, but we take the biggest part of low back pain, which is usually we might even not get to the reason of this low back pain. And quite often people who get low back pain have too much sedentary time, sitting time during the day. So, for example, for them, adding some physical activity would benefit. And the reason for that is that when we sit down, as we do now, then in the beginning we can keep up the good posture. And then after a while, our low back gets curved like this. Yeah. So this will add a lot of pressure to the discs of the low back pain and the lumbar segment of our spine. So just by standing up, our posture gets to kind of the normalizes. Yeah. So we get another position of our spine, and that relieves the symptoms quite often. So just like breaking up sitting enough and maybe even walking during these breaks would benefit many people who have low back pain. Not all, but quite many.
Yeah. And from the walking, you get kind of pumping motion that actually helps with the liquid flow.
So your metabolism of the spine is better when you're walking. So and another thing is also that quite often when you get low back pain, then I think still many people think that they shouldn't move, but it's usually the contrary. So also kind of like breaking this idea of staying put when having low back pain. That would be good to break.
Yeah. So as a practitioner, I can hear that you could see a lot of potential with many patient groups, osteoarthritis, low back pain, rehab from surgery. So there's potential, but it's not very widely used. What do you see as the problems and obstacles that we would need to overcome, that we could actually get technology to help in the rehabilitation process?
I don't really know. I think the obstacle is it that physical therapists maybe are also not they don't know about the devices we have already that we could use. Then probably it's also changing the behavior of physical therapists, that they would take these tools into use. Sometimes it's maybe also that with some of the tools, it's too difficult. You have to download apps and you have to, sign into. if it demands too much from the patient or client, then it's difficult, because as you know yourself, there's so many things on the computer or on your phone that you have to do, so you might not want to add another one. So I think the biggest obstacle is really maybe the knowledge of physical therapists, and then if the devices are too difficult to use. I don't think I can't really see other obstacles. Yeah, I think we should definitely start tracking activity much more.
Yes, and I think sometimes we might think that physiotherapy is not very open for technology, but I think that's not true. There's a lot of like electrical stimulation that they use in the treatment, and many technologies, when they have been just developed easy enough that you can just get the card and do, for example, the electrical stimulation and get done with it. So I think it's about the technology, like you said. Is it done easy enough to use? That is it really suitable for the clinical practice from the practitioner point of view, and also from the patient's point of view? And then, of course, the professionals need to know it. So I think those are really good points.
Yes, I think these are the key elements, really. And I'm quite sure that we will see more of that, using the devices and measurement tools in the future. I think physical therapy as a field is going into the direction that outcome measuring becomes more and more important in our work.
And now we have kind of thought about it, that it will make the rehabilitation process or the behavior change more successful. How do you see the role of measurement in kind of reporting, whether it's for the insurance company or for the governments, that how people are rehabilitating from certain things, like in a bigger picture? How do you see it as a reporting tool?
I see it in both of the things you mentioned are very important. First is reporting. Let's say that let's say that as in corporate wellness, you would buy some services for your employees. I'm quite sure that you'd like to know what's the outcome of your services. So this is where we could, it would be much easier to report, for example, that the physical activity levels of people, after educating people about the benefits of physical activity, that we could actually show and track whether it's working or not. So that's first. But the second thing, which I think is it's really important, is also choosing treatment. For example, at the moment, physical therapy in some of the problems, for example, rotator cuff tears, let's say 10 or 15 years ago, almost a huge part of these tears were treated with surgery. Nowadays, at least in Finland, the surgery rates have dropped, like, I might be mistaken, but around 50 or 60%, which is a huge drop in surgery rates, because we have found out that physical therapy is as um, it works as well as surgery. Of course, in not all cases, but with the minor tears. So in a larger scale, we could also measure different. We could compare different physical therapy treatment options, and then we could maybe compare physical therapy with some medications. Could we? In some fields, it's already done, and there's a lot of research going on in this field. But yes, I think in the end it would benefit the patient and the client, but also the health system, and we could choose most beneficial treatment plans for people.
Yeah, that's a really good point, that if we would actually have same kind of data that can be harmonized, it's measured in the same way, then we would get big enough data set that we could actually compare the decisions that you decided to rehabilitate in a certain way compared to A to B, and we could see that which one is probably more effective if people are having better activity levels sooner. It probably indicates that it's better. So I think that's a really interesting point.
Yeah, and in the it could be. I think measuring activity levels could be um, one of the things that we measure amongst others, but it's very important. It's an important factor that we could measure, and then when we draw the lines in a bigger health system of how do we treat certain problems, so I think we could make better decisions.
Yeah, I agree. So if you think about future, and what do you see? What would be an ideal tracking device for physiotherapy? If you think of dream device, how would it work? How would it fit your work day, and what kind of metrics it would give? Give us your dream device, and let's hear how it is.
um, I would like to see that first the device has a good it's easy. I could just give it to the patient, so that the patient wouldn't have to sign up to any any they wouldn't have to put their personal information anywhere, maybe only because I already have their name and, for example, their uh, birth date, their age, so on, so that I could use the same information. I wouldn't have to have the person to sign up to a web page or app to do that again. So that's, I think, first. There's also it's important. The second thing is that the battery of the device would last for long. That maybe that well, ideally the person wouldn't need to charge it at home, so that it would last until the next time I see the patient. It's the second thing. Of course, I would like it to be evidence based and reliable, and so that I would like it to distinguish between different. That I would see maybe the whole activity level of steps or minutes or whatever metric it is, but then I would like to see what's the proportion of daily activity and then the trainings that the person is doing, um, and also the passive time that they have. If I could just have all of these, and also, of course, that this device would give me a good report that I could then go through with the client and see what kind of changes might be good for them in their daily life.
Yeah. So how do you think, when you were saying about battery life, how long do you think you need data in each point? So, for example, if you are right after surgery? Do you need like 1 day, 2 days, 1 week of data? And then how long do you need to have these data points? For example, if you have every month one measurement, how long would you follow up the patient?
It's a difficult question, but I would say that at first, to get kind of the daily activity, maybe a week would be good, so that I would see working days, some days off. In the follow-up, I think it can be also shorter, maybe 2 or 3 days, that I see what's going on. Is there any change? So I would say that a week in the beginning, but like it's also important that when we have this measuring period, people forget and they have different things going on in their lives. So I think quite often it might be that the battery life should last at least maybe 2 weeks. So that if we get the 7 days of measurement, there might be that some days, for some reason, the person has forgotten the device home, or something happens. So this would be a good to have a long battery life. But yeah, follow-ups could probably be shorter.
Yeah, like we were saying, that the rehabilitation or physiotherapy needs to fit their life and life situation. So I think also the measurements are that we often forgot that people have so many things in their life, and wearing a measurement device or activity tracker or whatever might not be their priority, even though we might hope so. But yeah, there will be missed
Yeah.
days and so on always.
Yeah, somebody might get a flu and then they're in the bed for 2 days or something, and then they are quite unhappy if their activity levels are very low because of that, even though they without this flu, it might be even that the activity levels would be quite enough. So just to avoid that kind of mistakes in the data, I would like it to be long enough.
Yeah, I fully agree. So I have run out of questions at this point. Do you have any topics you would like to bring into discussion still?
I think we have gone through quite a lot what comes to activity tracking. I really hope that in the future we can use more technology also in physical therapy, and measuring the outcomes of physical therapy, and also measuring or kind of like showing people best practices, whatever it is, then for their problem. So
Yeah.
I think I'm good for now. Yeah.
Yeah, that's good. You said about rotator cuff injuries. I'm waiting for mine, because I know that I've been playing over 20 years of baseball in my past
Yeah.
life, and I have read that the supraspinatus tear is one of the most common problems, especially people getting old with the lot of throwing. So I will ask for your advice when the time is.
Oh, definitely. Yes. Yes. I've done some research about this also. So I can send you information you can read, but it's rotator cuff tears are very well treatable with physical therapy. So
Yeah, and I think also you mentioned prehab, and I think that's something important, that you can start to do prehab. For example, you know that there's a big risk of injury if you do certain kind of sports, especially if you start to approach 40 years of age and still doing sports. So I think it's interesting, and there's some studies showing that, for example, with eccentric training, you can strengthen your body against injuries. So do you have any advice for a prehab against injuries, maybe trail running injuries or something else?
we have some research. You said about the eccentric training. Eccentric training is good for some reducing pain. Also, isometric training actually is very good for pain. But the main thing really is that that the tendons that usually tend to get overuse injuries, our tendons kind of like change, but then they don't like change. I will explain it to you in a second. So if you increase your trainings in a short amount of time, then your tendons or muscles or even bones, so the tissues are not ready to take the load that you are putting on them in a short time. So always when starting to do some sports or maybe going back to what you've done before, and maybe there's been a 10-year gap, so you need to take into account that your tissue, the ability to take that load is maybe not the same as it was 10 years ago. So that's one. You should always add the loading like gradually, little by little, to kind of like perform or kind of like so that your tissues would have time to get used to. But then another thing is that the tendons really, I think like is maybe not a good word, but it's good for the tendons to give them different kind of loading. So eccentric, isometric, then concentric. So all kinds of slow movements, sometimes faster movements. So the more you kind of strain your tendons in different ways through your life, the stronger your tendons will be. So yeah, maybe that's my short answer to your question.
Yeah. No, that's good. I went like 5 days ago to do 10-second hill sprints in a steep uphill, and I'm still feeling it. It's still the inflammation there, so I know about changing the loading.
Yeah,
It's good, but you need to be really careful with it.
and you need to, yeah, yes. So you just need to give some time to now to rest, and then you can do it again.
Yeah, I agree. So, Liis, thanks for taking the time. This has all been very interesting. As a last point, if people want to know more about you, your trail running physio, where would be the best places to find you digitally?
Digitally, at the moment, my trail running physio site has a Finnish name. It's called Polkujuoksu Physio. Maybe we can write it somewhere.
Yeah, we can.
Maybe not all people got it. And I work in physios group. So also, when you just like Google my name, you'll get to see where to find me, and you can always email me or comment some of my writings in my blog.
Yeah. So we will put in the video
So
description link to Liis's webpage.
yes.
Yeah. So thank
Okay,
you.
thank you, Olli. It was great being here.
Yeah, thank you. It was great.